If you're a therapist or counselor thinking about launching your own practice or running a small health group, you already know this. The business side of healthcare can quickly become a full-time job, and that's not what you signed up for. Scheduling, claims, documentation, compliance, insurance. The emotional reality is this. Many fantastic clinicians delay starting a practice or burn out running one because the operational side is too intimidating and expensive. Today, we're taking a look at AdvancedMD Now, a platform built specifically for small mental health practices to address these challenges. This video is sponsored by AdvancedMD, but as always, we're keeping things fair, data-backed, and buyer first. Let's dive in. The state of mental health practices in 2026. The US is facing a major mental health access crisis. Over a third of the population lives in areas with inadequate provider coverage, and roughly 1 in 5 adults has a diagnosable mental health disorder. At the same time, many therapists want to launch independent practices, but traditional medical software is too expensive, too complex to implement, and overbuilt for solo or small group clinicians. AdvancedMD Now has entered the market with a very clear thesis: lower the barrier to entry for small mental health practices without stripping away core functionality. What is AdvancedMD Now? AdvancedMD Now is a practice management and EHR platform built specifically for mental health and behavioral health practices with 1 to 3 providers. It combines all of the following under one roof: practice management, scheduling, reporting, billing, etc., behavioral health focused EHR, telehealth, client engagement tools, and more. Notably, it starts with a 30-day free trial, followed by a month-to-month subscription at $130 per provider per month with no long-term contracts. That pricing structure is not accidental. It's designed to remove fear from the buying decision, especially for solo practitioners. Key features and differentiators. Number 1, purpose-built for behavioral health. AdvancedMD Now is not a generic EHR retrofitted for therapy. It includes templates aligned with DSM-5 criteria, support for long-form clinical documentation, treatment planning and progress planning tools, severity monitoring and outcome-based care tracking, built-in assessments like PHQ-9 and GAD-7, including iPad support, My Eye Only privacy settings for sensitive notes, and more. For therapists, documentation is often the most time-consuming burden. A template library with 300 plus customizable forms specifically designed for mental health conditions like depression, anxiety, PTSD, substance use, and more meaningfully reduces charting time. 2, one unified platform. One of the biggest friction points for small practices is stitching together all their tools: EHR, billing, telehealth, appointment scheduling, intake forms, client portals, and more. AdvancedMD Now packages all of that into one system. You get scheduling, including group scheduling, teletherapy with HD sessions, secure messaging and client portal, online intake and forms, appointment reminders, claims automation and ERA matching, ICD-10 coding tools, real-time financial reporting, and more. For a solo or 2 to 3 provider practice, eliminating multiple vendors isn't just convenient. It reduces integration risk, duplicate data entry, and operational overhead. Number 3, designed for speed and self-service. AdvancedMD Now uses a self-service onboarding model. From an analyst perspective, this is clearly aimed at clinicians who don't have an IT department or time to sit through months of configuration. Number 4, revenue and billing built in. Mental health practices often struggle with claims and collections. That's why AdvancedMD Now includes smart charge capture, claims automation, ERA matching, in-house billing workflows, and real-time financial reporting. For small practices managing commercial payers internally, having billing and clinical documentation connected in one platform reduces revenue leakage. Themes from AdvancedMD Now customer reviews. When you look at feedback from clinicians and practice leaders using AdvancedMD Now, several consistent themes emerge. Easy to navigate and time savings. Clinicians repeatedly mention the platform feels intuitive and efficient, even for users who aren't tech savvy. For example, Modern Mojo notes that it's an easy system to navigate, and they highlight that integrated EHR and billing saves time, helps them grow, and allows new team members to get up and running in about a week. Customization that fits clinical workflows. Safe Behavioral Health says, honestly, AdvancedMD Now is my favorite EHR. What I love about it is we're able to create our own specific tabs based on the forms or anything that we specifically know that we need when it comes to a patient's chart. That kind of customization, particularly for charting, is rare in smaller practice settings and reflects practical fit. More clinical time, less admin overhead. Bluebonnet Counseling frames the impact emotionally and operationally. AdvancedMD Now definitely levels the playing field. It frees up my time to be there for people to hear and help them. That echoes a broader theme where users say the platform helps streamline scheduling, charting, and visit tracking in ways that reduce admin burden, enabling more time for care. Analyst takeaway: who is AdvancedMD Now best suited for? Starting a mental health practice is deeply personal work. Clinicians don't go independent because they want to manage software, they do it because they want to focus on care. AdvancedMD Now is built around reducing friction for small practices, and it's well suited for solo therapists launching their first practice, small behavioral health groups with 1 to 3 providers, cost-conscious clinics that still need full EHR and billing functionality, practices managing insurance billing in-house, clinicians who want scheduling, telehealth, documentation, and billing in one system. Bottom line, AdvancedMD Now is designed to support small, independent mental health providers who want great infrastructure without heavy overhead. For more details, sign up for a free trial or explore more resources through the links in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time.